What is creatine and what is it used for? The human body naturally produces creatine. Creatine is a natural chemical compound found mainly in the skeletal muscles of the human body. It is made from amino acids such as arginine, glycine, and methionine, and is synthesized in the liver, kidneys, and pancreas. The highest amount of creatine is stored in skeletal muscles, where it plays an important role in providing energy for short-term, high-intensity physical activities. Creatine is particularly involved in the body's energy production process, especially in sports activities that require quick bursts of energy, such as weightlifting, sprinting, or jumping. When you perform intense activities, stored creatine in the muscles helps convert ATP, adenosine triphosphate, into energy, which directly enhances muscle power and endurance. Uses of creatine. Creatine can help increase power and endurance in sports that require explosive energy, such as weightlifting and sprinting. This supplement allows you to perform exercises with greater intensity and more repetitions. Creatine causes water retention in the muscles, which temporarily increases muscle volume. Additionally, creatine helps increase protein synthesis and muscle growth. Creatine can improve muscle recovery after intense training and help reduce muscle fatigue more quickly. Creatine can increase the number of repetitions and intensity of resistance training, which indirectly leads to greater muscle mass and strength. Research has shown that creatine can enhance brain function and may be effective in treating certain neurological diseases such as Parkinson's and Alzheimer's. Side effects and risks of creatine consumption. In some individuals, creatine consumption may cause gastrointestinal issues such as stomach pain, diarrhea, or bloating. These problems typically occur when taking higher doses or not consuming the supplement properly. It is important to note that for individuals with kidney problems, creatine consumption can put additional strain on the kidneys and lead to kidney problems. Therefore, people with kidney issues should avoid creatine or consult with a doctor. One important consideration when taking creatine is to drink more water, as creatine causes water retention in the body. Insufficient water intake can lead to dehydration and related issues, such as muscle cramps. Taking very high amounts of creatine, more than 20 grams per day for extended periods, can lead to gastrointestinal issues and, in rare cases, kidney damage. Does long-term creatine use stop the body from producing natural creatine? Long-term use of creatine supplements typically does not stop the body from producing natural creatine, although it may temporarily reduce its production. In response to supplement use, the body may produce less creatine because it becomes accustomed to receiving additional creatine from external sources. This reduction in natural production is usually temporary. After stopping the supplement, the body's natural creatine production returns to normal, which may take a few weeks. Research indicates that long-term creatine use, up to 5 years, is generally safe for most individuals, and the body can resume natural production. However, it is always recommended to consult with a doctor or nutritionist before starting or continuing any supplement, especially for extended periods, to ensure it does not negatively affect your health. When is creatine no longer needed? A guide to creatine consumption. For most people, long-term use of creatine is not necessary, and the body can return to its normal creatine levels after a period of supplementation. The duration of creatine use depends on the individual's goals, but if the goal is to increase muscle strength and size, creatine supplementation can generally be stopped after a specific period of use. Typical creatine use phases. Loading phase optional. This phase usually lasts 5 to 7 days, where higher doses of creatine, about 20 grams per day, are consumed to quickly saturate the muscle's creatine stores. After the loading phase, the body's creatine levels are sufficiently elevated, and a daily dose of 3 to 5 grams is maintained. Maintenance phase. After the loading phase, the individual typically takes 3 to 5 grams of creatine per day for an extended period, e.g., 4 to 6 weeks to maintain high creatine levels in the muscles. Rest phase optional. After 4 to 6 weeks of continuous use, some individuals may choose to take a break from creatine. During this time, the body will naturally begin to produce creatine again, and no supplementation is necessary. This rest phase usually lasts 2 to 4 weeks, after which creatine supplementation can resume if desired. Do you no longer need creatine after a while? After some time on creatine, e.g., several months, the body will return to its natural creatine production, and some individuals may no longer need to take the supplement unless they want to specifically enhance their athletic performance or engage in more intense or heavier training. In fact, if your goal is to maintain general athletic performance or muscle strength, after a period of creatine use and having adequate creatine stores, you may not need to continue taking it. However, if you require further muscle strength and size, creatine use may continue in cycles. Creatine is generally recommended for continuous use for 4 to 6 weeks, followed by a rest period 2-4 weeks. Ultimately, depending on the individual's goal and needs, creatine can be consumed periodically, and the body will continue to produce creatine naturally without supplementation.